as a very young girl, one of my memories is getting a tray and putting my grandmother's insulin on it because they kept it in the fridge, and then bringing her a glass of orange juice and literally delivering it to her on the tray. So I, from a very young age, had the caregiver vibe going. And a lot of that too was because of the way that I was raised. Around 19 years ago, I was diagnosed with sarcoidosis. I felt terrible. I felt awful. And so I do what everybody else does when they don't feel good, and you go to the doctor, and they put me on a bunch of medications. And the medications made me feel worse. I think 2 ER visits because of the side effects of the medications, because I'll never forget talking to the doctor when I said, is there anything else I can do? And he said, nope, that's all I have. When I was in the military, I got combat medic training, so they allowed me to work as an aide. I got my bachelor's in nursing. I'll never forget when the COVID pandemic hit. I received an email asking me if I had any interest in going to New York. We had to treat everybody like they had COVID, and the treatment at that point was if they were too sick and they couldn't breathe well, they were placed on a ventilator. I went to work one day and we were handed a memorandum that was from Governor Cuomo that said, basically, we're not going to be performing CPR on any patients. We were told that we were not to revive them. It was too risky for the healthcare worker. What? Against everything I had ever been taught, and just being a human being, you're like, well, if we're wearing our PPE, then what's the difference if we're taking the precautions? That just didn't sit right with me. And at that moment, I knew I had to get the hell out of there. Once I fully understood what was taking place and the truth of the matter, I could not shut up about it. All over social media, I was screaming from the rooftops, and I'm sure I got unfriended quite a bit on social media because I'm just very passionate about it. Now that I've used that knowledge to heal myself, I am passionate about telling my patients about it. That's why I got into nursing, is to help heal people. I did not get into nursing to keep them sick and dependent on a broken system. So I have like a new purpose in my life to help people.
Hey, so welcome to Born SuperHuman. I have an incredible lady here with us today. It's Nurse Kerrie, who I actually met by accident, but her message was so powerful, and it's true, we're laughing, right? But her message is so powerful because of the experience that she's gone through that I had to ask her to come and be on the podcast. Now, one of the things that separates Nurse Kerrie away from everybody else is the actual experience that she's lived through. But I'm not going to tell you that. I'm going to let Nurse Kerrie. Nurse Kerrie, great to have you here today.
Thank you so much. It's an honor to be here.
Thank you. So I want to jump right in. I want to find out first off who you are. So let's go back to when you were a young girl. Tell us about you growing up.
So growing up, I was born to parents that were 18 years old. So my parents were babies raising a baby, and I grew up in the New England area. I lived there until I was 15. But as a little girl, I was pretty much to myself. I was raised to, the whole saying, children should be seen and not heard. And so I didn't really have much to say as a child because I was not encouraged to express my feelings or to talk about things. So I think that's probably why I have such a loud voice now as an adult, because I'm kind of getting the things out that maybe I wanted to say when I was a child and I wasn't necessarily able to. So my dad was a musician and he worked odd jobs. He always worked 2 and 3 jobs. And my mom was a stay-at-home mom, and she was chronically ill with AVM, which for people that don't know, that's arteriovenous malformation. And so she was chronically ill. So as a young girl, I had to take care of myself and fend for myself. And so at a very young age, I had to learn how to live in survival mode, and that carried on into adulthood. And only recently have I been able to get out of the fight or flight mode of living. So a lot of the ways that I was brought up as a child carried over into my adult life.
One of the things that's great is there's a saying that those who talk don't know, and those who listen learn. So, and that doesn't carry on through life, but looking at you as a young girl, being the observer really and seeing the problems and yet not giving the voice, now you've gone full circle to someone that's actually revealing the truth that most of us will never experience. So, when you were younger, what is it you wanted to be? Did you want to grow up and be a nurse, or what was your dream?
Yeah, so I think I was around 8 years old when I knew I wanted to be a nurse. My grandmother stayed at my house quite often while my dad was a musician on the weekends and had late nights, and my mom would go with him. So my grandmother would spend the night, or I would spend the night over there with her, with my sister. And she was an insulin dependent diabetic. And they did things much differently back then, very counterintuitive, where they had the diabetic take orange juice when they gave them their insulin shots. So I remember as a very young girl, one of my memories is getting a tray and putting my grandmother's insulin on it because they kept it in the fridge, and then bringing her a glass of orange juice and literally delivering it to her on the tray. So I, from a very young age, had the caregiver vibe going. And a lot of that too was because of the way that I was raised and my environment. So, yes, I knew from a very young age I wanted to be a nurse for sure.
At what age did you, obviously, you went through high school, and then I know you went on to get a Bachelor of Science in nursing. What was that transition like from going from this young girl who was, like you said, a caregiver at such a young age, or seeing the care going on, and then suddenly you're thrust into this profession? Was it exciting for you? Was it suddenly nervous? I mean, how did you feel?
So I'll never forget when I actually graduated with my degree. I It was like all of a sudden everything that I had hoped and dreamed for since I was a little girl was coming to an end. And I had a tremendous amount of anxiety, and I literally went and saw a psychiatrist because I didn't know what was happening to me, because I didn't know what the next step for me looked like. Even though I knew that I would have a job, it was almost like, just all the moments leading up to graduation. And then there it was. And it was almost like I didn't know what to do. So it was a difficult transition. Um, so yes, I didn't know if I should go in the military full time, because I was an Army reservist at the time. So I did have that option. And so I was faced with, well, what do I do next? Do I get married and have children? Do I go in the military full time? What do I do with myself? Because for so many years, I knew, okay, this was the plan. I was going to go to nursing school, get my degree. And when it happened, I didn't really know what to do with myself. I didn't know what the next steps would be.
Yeah, well, first off, thank you for your service, because I know I was fortunate enough to go through 8 years of Royal Marine Cadet training, and I know whether you've gone to battle or whether you've served full time, there's still a sacrifice for your country. So thank you for doing that. And you actually went on to become, a essential worker for health as well, which is, thank you for your service there.
Yeah.
What was it like the very first day stepping into a hospital?
Oh boy. So before I got my bachelor's in nursing, I actually had worked as like a nurse's aide, because when I was in the military, I got combat medic training. So they allowed me to work um, as an aide. So one of my very first days, I do remember going into this little community hospital, and it was weird. It was honestly, because I can still remember that day. I'll never forget the person that I went to see. It was the house supervisor, and I'm like, "Hey, I'm Kerrie, and I am new. This is my first day, and I'm ready to work." And so they sent me to a telemetry floor. And one of the first patients I came across was a patient that had lupus. And she was dying. And she was very young. I want to say she was in her 40s. And I'll never forget her because she had children. And I remember how impactful that was to me, which ironically, later on in life, I also developed an autoimmune disease. And so I think that was definitely a purposeful meeting, divine appointment for me to think back about that experience with her.
How much longer was she able to live between you first meeting her and then, leaving her children?
I honestly don't know because I worked with her just for that one day. So I don't know what happened after.
That's amazing because it just goes to show we never know the impact we have on people. But look at that lady.
Right,
Never know the impact she had on you that to this day you still never forgotten. After all the experience you had, it's still something you never forget. And I think that's so important for anyone listening to realize we never know
right.
the impact that we have. So let's jump forward a little bit because you're now working, you're in the hospital system, you're in the big medical system. Take us through your first experience because I know you went through your own health issues as well. Now, was that when you were working in the system and you had to try and make the system work for you? Tell us more about that.
So when my son was a baby and he's 20 now, so I would say around 19 years ago, I was diagnosed with sarcoidosis. And I didn't know what was wrong with me. I was having joint pain, like severe joint pain. I was extremely fatigued. My cheeks were red and rosy, and I had this thing on my forehead, like a lesion, but I never put the two and two together. I thought it was just something separate. And I felt terrible. I felt awful. And so I do what everybody else does when they don't feel good, and you go to the doctor, and they put me on a bunch of medications, and the medications made me feel worse. I actually ended up in adrenal crisis, and I had, I think, 2 ER visits because of the side effects of the medications. And so I just decided I wasn't going to be on the medications anymore. So I was at the time working as a nurse, and my children, let's see, my son at the time, like I said, was a baby, and my daughter at that time was probably around 3 or 4 when I had that diagnosis. So the medications just made me feel worse. And I said, well, I guess this is the way it's going to be. This is going to be my life. And this is something I'm just going to have to live with. I was never given any other options as far as something to do besides taking medications. That was the only options because I'll never forget talking to the doctor when I said, is there anything else I can do besides taking prednisone? I said, that's a pretty strong drug and it's making me gain weight and it's having all these side effects. And he said, nope, that's all I have. So I said, well, nothing about, things that I've learned recently, nothing about getting out in the sunlight, nothing about drinking high quality water instead of drinking dead water from the tap with toxins and fluoride. Nothing about just taking a few walks a day, getting out in nature. Nothing about balancing my circadian rhythm. None of that was discussed with me. It was basically, this is your only option. And of course, thinking back to that patient I had that had lupus, and lupus and sarcoidosis are both autoimmune diseases. So, of course, I was like, oh my God, I'm going to end up like her. And I didn't want to end up like her, but I didn't really know how to fix that. So, I just lived with it up until a little over a year ago.
So how many years has that you've been living with it?
Well, so about 19 years now.
19 years.
Right.
It's amazing because I know how many people that I've been fortunate enough to work with and some great doctors and people like yourself that really care about others, how much life has been lost when
Yep.
doesn't mean to say there's a guarantee of a healing, but there's certainly a guarantee of a better quality of life and also belief in where you can go. So one of the stories that you told me that fascinates me is COVID.
Yeah.
and you having to work as a nurse during COVID with all the information that was being given to us. I'd love for you to share your experiences. And I want to say this to the audience as well. This is not made up. This is not fabricated. This is truly Nurse Kerrie's experience. It's not a conspiracy theory. It's none of this stuff that people want to shut off. I'm so curious, and I think you've got to stay passionately curious to have an open mind to say, what are we really being taught? So with that lead in, it sounds a little dramatic. It's not. Tell us about your experience, because I believe, if I remember rightly, you went up to New York.
So I had done some hurricane relief jobs as a nurse with a company that actually is contracted by FEMA. And when the COVID pandemic hit, I received an email asking me if I had any interest in going to New York. And me being the Army soldier that I am, I said, wow, I said to myself, wow, this would be an amazing experience for me to go kind of serve my country in a way that I hadn't before, because as a reservist, I never went overseas. I never went anywhere, never served, during a wartime. So I thought, well, this is what I need to do. I had a discussion with, my children and their dad, and they said that, they were going to support me going. And so I got on a plane. It was just myself and two other nurses from my town. And there was hardly anybody on the plane. We had the whole plane to ourselves, basically. And when we got to New York, it was really weird. There were still some stores open, but a lot of them were closed. And we were the first nurses to arrive at the hotel in Manhattan. And so we had a couple of days before the other nurses were going to be arriving. So we just kind of walked around the city, and it was, like I said, it was just weird. Just how you see New York, how normally it's so busy and all the hustle and bustle and a lot of things going on. And it was, I would say, probably 70% shut down, if I had to give a guesstimate. So we were just kind of getting some toiletries, getting some things. And when the other nurses arrived, we were given our assignments, basically the hospital that we were going to be assigned to. And so they had us working 12-hour shifts, and we worked 21 days in a row. So our contract was to work 12-hour shifts, 7 days a week, for 21 days with no break. And while we did that, there were nurses that were in the hotels that were just on standby, which I thought was really strange. Why are we working these nurses to death, being in an N95 for 12 hours a day, 21 days in a row? Why aren't we doing 3 shifts and then letting the other nurses do 3 shifts or something like that? It made no sense, but that's just the way it was. So we would get up early in the morning, and we would get on the bus. And when you get on the bus, you are going through Manhattan. And at that moment, I realized I felt like I was in a movie. I felt like a character in a movie. And because New York was completely shut down, I still have photos of the empty streets, everything shut down. There were a few select things open. I think Starbucks was open, McDonald's was open. There were a few places still open. But I'll never forget the actual drive to the hospital and just how it felt. Like I said, I felt like I was in a movie. And then I would always pray on the way because I was scared. But once I gave it to God, that no matter what happened, if I got sick, because we didn't really know much about what was happening. We were just being fed a bunch of stuff from the news, and they had the death ticker. So I didn't know if I was going to come back home in a coffin, or I didn't know. I had no idea, but I gave everything to God, and that gave me a tremendous amount of peace. And so I remember mornings where, as I was praying, the sun would shine into my face. So that's when I knew that God totally had my back and that I didn't need to worry, and that I was just there to take care of people. So I would we'd get to the hospital, and we would be issued, and we got an N95, and they gave us paper scrubs to put over our scrubs. Um, and then they basically told us that that N95 was to be used for 5 days in a row, and they handed us a paper bag. And so we had to wear the N95 at all times in the nurse's station, no matter what. We could only take it off to have a drink, to take a break. So have a drink and eat. So that was probably the best time of the day, when you could take off the mask and go into another area and actually breathe and have something to drink and eat. We would sweat tremendously because of all the PPE that we would have on. So we would have our scrubs, and then we'd have the paper scrubs, and then we'd have the bag, I call it, over us, because it was a vinyl type gown, and you would sweat. I think I lost 10 pounds the first week just from sweating. And then I was assigned to the emergency room. Some of the nurses were assigned to the ICUs. So I was in the emergency room area, and we actually had tents outside. So I think what they were doing out there was just triaging. So the walkie-talkie type patients were outside getting checked. And in the beginning, they were giving them hydrochloroquine. And then all of a sudden that stopped. And I thought that was really interesting.
Why do you think that it stopped?
It was right after Trump made that announcement about hydrochloroquine actually helping. And then, of course, everybody was getting on the bandwagon on the mainstream media saying, that how that wasn't working. So they stopped issuing that. They stopped prescribing that. And that was right around the beginning or mid-March. So they had already been seeing patients for a little while before we got there. So I thought that was interesting.
Were people actually getting better, though, at that point from taking the treatment prior to the stop? Were people actually getting better from it? Was it having an effect?
So I personally don't have any experience with that, but I heard other staff, other nurses saying that it was helping people and that they couldn't understand why it was stopped. So I can't speak to my personal experience. I can just say what I heard from other staff, that, the nurses that were already working there, that's their home base. That's their normal staff nurse job. So I cannot speak to that. So there was a triage area outside, and then the patients that were sicker would come inside. And of course, we had to treat everybody like they had COVID. And the treatment at that point was, if they were too sick and they couldn't breathe well, they were placed on a ventilator. And most of them spoke Spanish. This was a high Spanish community. And there was no way for us to translate. We didn't have any of the tools that we needed to be able to communicate with our patients. So a lot of it, we couldn't take your phones out because you don't want to expose the phone to whatever the bug is. So it's a city-funded hospital system. So you really could not communicate with the family. Now, towards the end, there were ways to FaceTime, but at that moment that I remember first, it was basically the patient went in a room, the door was closed, you'd go in there to medicate them, and that's pretty much it. They had the IV pumps outside of the room, so the IV pumps weren't even in the rooms. So if you needed to hang another bag of fluids or that kind of thing, because they were trying to minimize our exposure. So I do remember the IV pumps being outside of the rooms. And I also remember when physicians rounded, most of them did not go into the room. They would just ask us questions, ask the nurses questions. They would not go into the room and speak to the patient, but they would go ahead and chart in the medical record that they saw the patient and that they listened to their lungs. I do have an example, not in New York, when I went to another COVID assignment, where literally a doctor called a nurse that I was working with and asked her, "So how did that patient's lungs sound today?" And she said, "What do you think they sound like? They're COVID lungs." And so there were doctors that weren't even coming to see their patients. They were just calling the nurse, or they were calling the patient when the patient was in the room. So there were not a lot of doctors going into the rooms to see the patients. The nurses were the ones that were in there.
Let me ask you this
I
real
want
quick.
to. Mhm.
Yeah, so I remember watching it very closely, and there wasn't one case of flu during the whole COVID time. Now, I've got a question. Does COVID kill flu, or was it a case? Because I know there was money involved, and
Yep.
again, I've never been able to find out how many people, while you were there during the winter, I believe it was during the winter, right? It was when it first really hit.
March. It was March.
And there's still flu going around at that time. How many patients did you actually treat for flu during that time?
Zero. We stopped testing for the flu altogether. All the patients received was a COVID swab. That was it. It was like all of a sudden the flu miraculously went out the window, and I questioned it. And I just felt like it fell on deaf ears. Nobody had an answer for me.
So, what was happening to the nurses during this time? Because if you know that there's certain protocols that are being followed that may not be in the best interest of the patient, and your job, this is why you got into it, was to actually help people get better. What was
Right.
the feeling within the nursing community, and how did that affect you?
So it was rough. I'm gonna tell you, I had PTSD for a few months after I got back because um, I'll never forget a conversation I had with my son, and just telling him how patients literally couldn't breathe. And after, that I would be the last person they would see. They would come in short of breath, and they got put on a ventilator, and then they went to the ICU, and most of them died. And when there were patients that didn't die, we celebrated that. So you just feel like all you can do is offer a gentle holding their hand. But then again, it's like we had no tools to be able to translate. And, we were told, don't go in the room. And it felt so against everything that I had been taught. So it was really difficult. And then, so I just remember seeing the fear in patients' eyes. And I'm getting the chills as I say that, because I will never forget this one man who looked at me so scared. I could see it in his eyes. And I might have been the last person he ever saw. And families were calling, and we had no way to communicate with the families. And I'll never forget, after my 21 days, I had decided I was going to stay. And within 2 days after the 21 days, I went to work one day, and we were handed a memorandum that was from Governor Cuomo that said, basically, we're not going to be performing CPR on any patients because it's too risky. So if they come in and they're in cardiac arrest, or if somebody goes into cardiac arrest or respiratory arrest while they're a patient in the emergency room, we were told that we were not to revive them. It was too risky for the healthcare worker. And that, to me, was like, what? Again, against everything I had ever been taught. And just being a human being, you're like, well, if we're wearing our PPE, then what's the difference if we're taking the precautions? So that just didn't sit right with me. And at that moment, I knew I had to get the hell out of there. It did not feel right. And so I booked the next plane out of there, which I'm sure you remember. There were not a lot of planes coming and going. I think there was maybe one plane every few days leaving New York City even. So it took me a few days to get out of there. But once I got out of there, I felt so much better. But there were nurses that stayed for several months after that. But it just, I had to get out of there. I had to get out.
How crowded were the hospitals? Were they really as bad as the news made out, with the um, what was it, the ice trucks coming around, the freezer trucks, and they were bringing in ships to put the sick on? Did you have any experience with that?
So yes, they did have the trucks out in the back. I personally never saw the inside of the trucks. I never saw the inside of them. If you want me to gauge how busy they were, I'm going to tell you that I feel like we're busier now with sick patients um, than it was in New York now, if that makes any sense. But when I went to Texas, it was really busy. But when I first got to New York, I remember the staff nurses saying to me, "Oh, you should have been here a week ago. It was really bad a week ago." So by the time we had got there, by the time we showed up, it wasn't that, from what I understand, it wasn't as bad as it was a week or so many weeks prior, that they had really had a big wave of sick people. Um, I can tell you that we had a ton of nursing staff because it was all funded by the government. We were tripping over each other. We had more nurses than you could shake a stick at least where I was. I have talked to some nurses that say, oh, no, we didn't have that at all. But the hospitals that were funded by the government funding, we had nurses tripping over each other. So that's why I never understood why they wanted us to work 21 days in a row. It was almost like it reminded me of being in boot camp, to be honest. It was like physically demanding, mentally demanding. So that's how I remember describing it. So it was definitely interesting times. But again, as far as how busy it was, I in New York, it didn't seem as busy as it was when I went to Texas, if that makes sense.
So I remember on the news when they brought in the military hospital ships. Were you there during that time?
Yes, I was. I remember seeing it on the news because, of course, the news was blasted all over the hospital. Every TV had the news on 24/7. And I remember the ship coming in, and I remember feeling, wow, this is such a relief that we, can send some of these patients on the ship, because we were holding patients um, in the emergency room that had COVID, and we were sending those nursing home patients back to the nursing home with COVID. So I thought to myself, wow, this would be such a relief if we can maybe put all those patients on the ship. But that never happened. Instead, those nursing home patients were still sent back to the nursing home to give COVID to everybody else and spread it around. So, to my knowledge, just from some of the things that I've read, there were not many patients on that big ship at all. And my opinion is that that was more of a propaganda tool, and just another psyop, I guess you could say, just another tool to feed the propaganda machine and to get people to be like, oh, wow, must be really bad. And so none of those nursing home patients went there. Another thing I can tell you is that they had, I don't know if it was the National Guard or if it was full active duty soldiers. They had them at the like the Odom, I don't know what you call it, but in the downtown city, they had like a staging area there with all kinds of cots for patients, and that stayed empty. It was like a convention center, I guess you could say. And you would just see the military folk walking around, and they never had any patients in there. So that was interesting as well.
It makes sense, and I know this already, but fear attacks the immune system through the
Yes.
stress that we have and takes down our ability to heal.
Yeah.
Tell me what you were seeing with the patients, the fear, and how you feel. You're a
Oh,
great experience. What effect that had actually on people with COVID?
oh gosh. I mean, yeah, well, I mean, you have the news on nonstop feeding the fear. And fear is just such a low vibe energy. And, you know, even in my everyday practice, I find that patients that live in a perpetual state of fear, or people that worry all the time, they don't do as well. They have worse outcomes. Mindset is everything. So if you're scared and you're watching the news and you're watching the wrong things, exposing yourself to things that are not positive, you're going to have a worse outcome. And so I do remember seeing patients scared, and they would talk about how scared they were. And so you try to reassure them the best you can. But we were stuck right in the middle of all the propaganda too. So it was really a time where I had to discern what is true, what's not true. And that's when I started finding some people that were questioning the narrative. And so I started following them for their insights. And I'm so grateful for that, because it really helped me understand what was truly happening. Because when you're a pawn in their game, and you're going to the hospital and taking care of these patients, and you're being shown all over the news about being essential workers and things of that nature, it's just you can get caught up in it. And so there are people that are pissed off at the medical professionals because we're there taking care of the patients and going along with it. But I want people to understand that a lot of us were just in the middle of this chaos and propaganda machine, and we just wanted to take care of the patients. And so a lot of us didn't really fully understand what was happening until a little bit later. And for myself, once I fully understood what was taking place and the truth of the matter, I could not shut up about it. All over social media, I was screaming from the rooftops. And I'm sure I got unfriended quite a bit on social media, because I'm just very passionate about it, about spreading the truth about what was happening. And, I was labeled a conspiracy theorist. I lost friends, family shunned me, and it was a very isolating time. But I felt comfort in connecting with like-minded individuals that could see what was happening and that were sharing the truth, and we could talk amongst each other. And that's where I found comfort.
What was the message that you were sending to people then on social media? I mean, again, you're fighting this machine of information.
Yeah.
What were the things you wanted people to know?
I wanted people to know that it wasn't as bad as they made it out to be. The death ticker was ridiculous. I wanted people to know that the treatments that they were giving were killing people. The ventilator, the remdesivir, because the remdesivir was putting patients into renal failure, and then they would become a dialysis patient. So the medication was burning up their kidneys. And the fact that they were withholding treatments that were shown to work, the antiviral ivermectin, which actually is now shown to cure cancer, one of the modalities. And I just wanted to let people know that the government wasn't telling us the truth, and people like Anthony Fauci were lying. And what Governor Cuomo did, I wanted to let people know how he put out an order to basically let people die without giving them a fair chance at reviving them. And of course, when the COVID vaccine rollout came, I knew that there was something not right about it. There was a lot of pressure to get the vaccine. And again, I feel very blessed to have the gift of discernment, and then also to be connected with people that were doing the research in regards to other countries that had already had the COVID vaccine roll out. And there were other countries that had already had it for 6 months, and seeing the data from 6 months before as to how people were getting reinfected and how people were dropping dead suddenly. That's when I knew I had to spread awareness. But again, I got labeled a conspiracy theorist. I was shunned by coworkers, by friends, by family. So that didn't matter to me. I continued to speak out, and I never got the vaccine. I dodged that bullet. There was a lot of pressure to get it, and a lot of people gave in because they were that fear, right? The fear that they were going to lose their jobs. Like how am I going to pay my bills? How am I going to feed my family? How am I going to pay my, how am I going to pay my mortgage or that kind of thing? So a lot of people just gave in because they were scared.
So heavy dialogue. Anyone listening to this, some will accept it, some won't. For me, it's fascinating because we still now get the information coming out of the after effects of the vaccine. And some people don't want to admit it. And I'm going to sit here and say, whether you got it or not, that positive mindset of the body being able to go on and heal is so critical because I don't think it's not like you said, people were coerced into taking it. It's not whether they're good or bad because they took it or didn't, but it's now what do we do to make sure we can get back to optimal health from there? So I know part of your journey, and I've seen your social media posts and I see the passion that you speak with. What changed your life to go from this quiet young girl into the war zone of COVID to then have this voice because of your passion? And now you're on this whole new mission of education of natural healing and the things that we can do. So tell me how you got into that and where do you see that going now?
Well, yeah. So a little over a year ago, I started having more health issues and I didn't know how to fix myself. So I had a spiritual revelation that I needed to start seeking natural healing. So I was like, oh, okay. So I started looking into that and I came across integrative medicine physicians, functional medicine physicians, holistic practitioners, people that were in the wellness space. And I just went completely down that rabbit hole and I learned so much. I just so much valuable information. And with all the information that I learned and the things that you need to do to get better are really not difficult. We tend to make everything so complicated, but the healing process, I mean, it does take time. It's not a pill you take and you're fixed in a week. It's a process. So the things that I learned, I used, and I healed myself within the first month of doing some of these things, such as phototherapy and, of course, the diet. The diet changes. I didn't go on a diet. I changed the foods I was eating. I went to the farmer's market and bought whole foods. I stopped buying meat from the grocery store. I started buying it from the farmer's market. And I started drinking quality water. I stopped drinking water out of a plastic bottle. And I started going outside more, getting in nature. And I stopped wearing sunglasses because I knew the sunglasses can affect your melatonin levels and mess with your circadian rhythm. I just made some basic changes. And then I started looking at the products that I used on my skin and that I was using, like certain dish soaps or laundry soaps. Just started looking at the products, changed my toothpaste, got rid of the fluoride. So I just started doing little things, little by little. And I noticed results within a month of making some simple changes. But as time has gone on, I've made several different changes. So it all, I feel like, is cumulative. And I mean, I'll be 50 this year and I feel amazing. I really feel good. I have a lot of energy. I'm happier. And, with this healing process, I've also had to do some trauma healing, just my story about my childhood and how I was having to take care of things at a very young age. And so I had to let go of a lot of that, anger, resentment, and why me, and those kinds of things. And so that was a process too. So if somebody is looking at going on a healing journey, you have to look at your trauma because your trauma is stored in your organs. And I didn't know any of that. And so when a patient comes in now and they come in with a new onset of something, I don't know, they come in with all these stomach issues. You have to ask them, what happened recently to you? It's not like, what's wrong with you? You want to ask somebody, what happened to you? For and that's how you get the conversation started. And so now that I've learned these integrative approaches, natural approaches, however you want to describe it, now that I've used that knowledge to heal myself, I am passionate about telling my patients about it. And, I've spent many, many months deprogramming myself and learning these other modalities. And I'm just so passionate about sharing with people, because that's why I got into nursing, is to help heal people. I did not get into nursing to keep them sick and dependent on a broken system. So I have like a new purpose in my life to help people get better just by sharing my story and helping people, see the value in making simple changes. Again, it doesn't have to be complicated. You can do simple things to get better, and it's amazing. So,
yeah, it's interesting.
I've also, yeah.
So let's say somebody's watching this and they say, okay, Nurse Kerrie, I'm really interested in what were the protocols that you did. Can you give specifics so that right now someone listening could say, okay, this is what I would do first, this is what I should do, or maybe this is something. Give me some specifics that really help someone understand and take that step.
So the first thing would be to get rid of the processed foods and go to whole foods. Stop eating junk out of a box. And then I used phototherapy. I used a phototherapy patch and the clean water, and definitely looking at the products that you use every day, the toothpaste that you use. If you wear cologne, stop, because that is an endocrine disruptor. And then start taking a few walks a day, and have gratitude. Thank people. Text somebody and offer them encouragement. That's really important. And then, of course, mindset. You have to know that you're going to heal. I've come across several people that just have this stuck in their mind that they're not going to get better. And guess what? It doesn't matter if you wave a magic wand over these people. If they think they're not going to get better, guess what? They're not going to get better because they have that mindset. So you have to be all in. You have to have the mindset and say, I'm going to heal and I'm going to do this.
Where did you find the information you're now getting? Or let me rephrase that. Uh-huh. You went on this journey. You've been in the medical business, right, by being in the environment that you were in, and suddenly you knew there was something else out there that you had to find.
Right.
Set up your journey. Where did you go to find it? Because I think people are so scared to leave what they know, but at the same time, right, they're not sure they want to trust the other side. So we're kind of stuck. What was your journey? I mean, how did you find this?
So to be honest, when I had that I guess you could say that revelation that I needed to start going down the natural healing path, and I didn't know what that looked like. I just started reaching out to people and just said, look, I've got to do something different as far as my job goes. I've got to get out of the hospital. I don't know what that looks like, but just let me know if you see anything or hear of anything. And a couple of months later, an ex-boss reached out to me and said, hey, there's this physician that's looking for a nurse in his integrative medicine practice. And so she's like, it might not be anything. You could just check it out because it's just part-time. But I started looking into what he had to say, and it made a lot of sense. And I learned a lot from him. And he is the one where I learned about the phototherapy treatment and all the simple things that you can do to get better. And so, of course, I started looking at who he was following, who he was collaborating with. And it, like, one thing led to another. Next thing I know, I'm watching a quantum biology podcast or listening to it. And it's just like a perpetual one leads to the next, leads to the next. And then, of course, just hearing people's stories of how they healed by using natural remedies. I came across Medical Medium at one point and saw his amazing stories of how people were healing their skin and autoimmune and cancer and diabetes just by changing what they were eating. So you have to see the real stories to trust somebody and to believe it. And once you see that somebody else can heal using these treatments, you're like, oh, well, I can do that. So that's how it went down.
So where do you see yourself going next then?
So right now, I am collaborating with Dr. Ilyas Bagli about his cancer protocol. He's the lead author of a cancer protocol that came out a few months ago. And I'm really passionate about getting that protocol out because right now, if you go to the hospital and you are diagnosed with cancer, you will not be given all of the options. You're going to be given the options that the hospital wants to give you. And so, what if you go to the hospital and you want to try this protocol? Guess what? You can't because they don't offer it. And what they will tell you is, oh, that hasn't been studied. Well, neither has the experimental drug that you're offering for their cancer. So that seems a little interesting. So what my mission is now is to make people aware that there are integrative approaches to healing and that if people are made aware that there are these other options, then they can start demanding that these options be made in the hospital. Because if you are not given all the treatment options as a patient with, say, cancer, then how can you truly make an informed decision? You have to have all, of the treatment options made available to you in order to make an informed decision. And so recently, I had a patient that was diagnosed with cancer, and she was talking, her and her husband were talking about how they were going to start looking into this experimental drug. And something told me, I think it was God, told me it was okay to share this protocol with them because you never know how things are going to be received right now. Because, the integrative doctors or people that are into natural healing are referred to as quacks. And so you have to be really careful because you're building trust as a nurse, but then you're also trying to give them this information. So it's a slippery slope. So, but I felt safe to be able to talk to them about this protocol. And the husband, who was very involved with his wife's care, it was so sweet. When I told him that there was this protocol that was being used at the Reardon Clinic in Wichita, Kansas, it was like a light bulb went off. He said, oh, I've heard of this clinic before. And I said, well, have you heard of the protocol? And he said, well, I've never heard of the protocol. So he got his laptop out. I started typing in Google the protocol, brought it up, and he started looking at it. And, we had this little conversation. And then when I went to say my goodbyes at the end of the shift, because usually I'll close and, just thank people for letting me take care of them. And they were expressing their gratitude for me sharing the protocol and basically said, thank you for caring. Because that's what it's about, right? You want the patient to get better. And, I guess I could technically be risking my job by sharing that information. But for me, it's more important for people to get better. And I feel like God will guide me and God will take care of me if that were to happen. So,
Yeah, I think it's really, like you said, it goes back to the fact that you care. And it's very hard, like you said, the PTSD that you suffered later on, the whole nursing thing, when you know there's things that you could be sharing, and yet you could lose your job by sharing it. At what point does that moral issue become about the person and not about you? So I appreciate you for sure coming out. I appreciate you for sure coming out and sharing this information.
Yep.
If there was one thing that you would want the world to know, one thing that you could leave as a message, whether you were here today or not, what's that one thing that you would love everybody to know?
I would say um, work on your spiritual journey and get to know the true purpose of why you are here. We are all here for a reason. Um, Work on yourself, um, heal your trauma, and all of that will raise your level of consciousness and make you more aware of things that are going on around you. And when people start seeing that you are living in your purpose, then that will inspire them to live in their true purpose. And that's how everybody can elevate their level of consciousness and how we can just be a happy and peaceful world.
That's beautiful. Well, Nurse Kerrie, I really appreciate you being here, sharing your incredible story. It's a true sign of resilience and also the humanity that you bring, the integrity that this little girl grew up wanting to look after people and now taking it on a mission that's not easy. I know it's not easy. We face the same things and people constantly questioning the validity, even though the proof is there. So
Right.
I look forward to continuing to follow you on social media. I look forward to
Yeah.
continuing to hear your story. And I urge you to write a book one day. Get a book out talking of your story, your journey, because as you said, that lady at the very beginning with lupus, you've never been able to forget the impact that you
Right.
have can also be something that somebody will never forget.
Yep.
Thank you so much for joining us here at Born Superhuman. And again, if anybody wants to follow, I will be dropping in some information so they can follow you along in there. But thank you so much for your time and keep doing the great work.
Thank you. Thank you so much for having me. I'm very grateful. Thank you for letting me share my story.